You know, we've been struggling in the community to help families provide the basic needs for their children themselves, and I just think it's a great opportunity to be in the stepping stones of establishing a health care clinic for the people of the community.
Over the last several years, I've had an opportunity, by God's grace, to see that there are needs all around us. Regardless of the community that we live in, whether we realize it or not, the needs are there. The question is, what are we doing about it?
My wife, Mikey, is the secretary at Central Elementary, and she and I have talked numerous times over the years about the need that she sees at the elementary school level.
I went to seminary in Kansas City, and it was part of this type of a clinic there, and saw firsthand how it really can implement or make an impact on individual lives and also hope for the future. I think it's something that we can all come together and be united around, especially as a faith community. We know that as Christians, we're called to serve all people, not just ones that may be like us, but all individuals.
The question we get asked most often is, what is our response as a community to the Affordable Care Act? And that's a good question, because it is presumed that the Affordable Health Care Act will take care of all individuals within our community and provide insurance. But that is not necessarily the safety net that all of our individuals in the community will have.
I decided to serve on the board of the Helpcare Clinic because as a pastor I see an opportunity for the community of Kearney to meet the needs of the poor among us. Meeting these needs not only is important in building faith, but also important in building the community that God desires for us, a community where the least of us is served in love and with respect.
My role in the community, I serve as the Health Services Director for Community Action Partnership of Mid-Nebraska. And that agency is dedicated to helping people help themselves and each other. That is part of our mission. And we have a variety of programs. And my phone continues to ring today with people needing health care access. It's a variety of things, from help me find a place to get my cataracts removed, or help me find my diabetes medicine. I have a sick child, what should I do? My child needs a school physical, I can't afford it, but it's required by law, what do I do? There's just a variety of needs in this area, and I'm just amazed at the phone calls I still get every day.
Well, my role as Regional Administrator for Region 3 Behavioral Health Services, I really see the need for the opportunity to integrate primary care and behavioral health care through the Helpcare Clinic. It's exciting because it's way past its time.
I decided to become a part of the Helpcare Clinic and wanted to help be a part of it because of my role in the community as the leader of Good Samaritan Hospital. And firsthand, in the 4 years I've been here, I've seen the need there is in the community. In addition, a couple of people in the community have come to me within the first years here and said, we know of individuals in the community that are in such need and we don't have a place to refer them to. You've got to help us do something.
Over 40 years, our medical community has delivered a lot of free care. But that care oftentimes is episodic and acute care. It's not giving people what they need in the continuum to make them healthy.
Free and charitable clinics are safety net healthcare organizations. What they do is operate using volunteer staff, and they provide medical and behavioral health services. The care that's provided is free of cost to people. And these people are people with limited incomes, no health insurance, and they don't qualify for Medicaid and Medicare. We would love to have you join us in helping to care for those in need. You can do this through volunteering to work at the clinic. You can volunteer to help in one of our committees that are planning the clinic, or you can help by supporting us financially. Our mission is to improve the health and well-being of the uninsured residents of Buffalo and Kearney counties. And we want to provide medical and behavioral health care in a compassionate and respectful environment. The tagline for our Helpcare Clinic is, "I was sick and you cared for me." And that comes from Matthew 25:36. We know there are those in this community that want to help care for those in need.